Today we're going to give you a little bit of an anatomy lesson. You know, when you go see a spine surgeon, you get really confused. What is this? What is that? So we're just going to give you a little basic anatomy lesson. So this is the lumbar spine, all right? We have basically 5 lumbar vertebral bodies and 1 sacrum, all right? When spine surgeons say L1, 2, L2, 3, L3, 4, what we're basically talking about is we're localizing the area in the spine that we think that there's a problem. So if I say L5, S1, L5, this is the L5 vertebral body and this is the sacrum. So L5, S1 put together means that at this area right here is the problem. Now when we look at the spine, of course we have bone, we have disc, we have bone, we have disc, we have bone. We see these things and we identify them. The other thing that we have is spinal cord and nerve roots. All right, so our spinal cord for most people terminates at L1, sometimes L2, but for the vast majority it's in that region. Now what that basically means is from our brain all the way down our spinal cord, it's one big ball of spinal cord. It doesn't break out into the small little nerve rootlets. So up in here somewhere, what happens is the spinal cord terminates and becomes a cauda equina, all right, which is another word of saying the horse's tail. And then through that, all these little nerve rootlets come out from there. Those little nerve rootlets, they come out here at L1, 2, L3, 4, L4, 5. And you can basically see how the spine is organized with this model. We've removed the back of the vertebral bodies, the lamina specifically, to kind of show the spinal cord. Now, if you will, once the spinal cord terminates, it actually is like nothing more than a glorified water balloon, like one of those funny clown water balloons filled with spaghetti noodles. That is the dura. The dura is a protective sheath of the spinal cord and the nerve rootlets. And that dura is filled with water, and that's actually cerebral spinal fluid. That's the same fluid that goes down your spine all the way up to the top of your head. So that's how the spine is organized, generally speaking. Now, let's talk about specifically L5S1. Let's say you herniated a disc at L5S1. For the vast majority of the problems that patients have, the disc is paracentral. It's off to the side. Para means off to the side. That would actually affect the S1 nerve root. That S1 nerve root goes down the leg. So if you will, you can think of the spine and the nerve roots like nothing more than a glorified water hose. You take the spigot, you run the hose down the driveway, you turn the water on. If I was to clamp that water hose at any one place, all the way down, there would be decreased water. Well, the body senses that as pain, numbness, and tingling. So for the vast majority of patients, you can have your spigot or your spinal cord or your nerve root basically pinched and you get downstream symptoms. And that's the way nerves and the spinal cord work for the most part.